So if that's the case with aspirin, then what's the deal with ibuprofen and acetaminophen? Okay, well the thing about aspirin is it doesn't just do these three things. Aspirin, as it turns out, has other effects too. So that tells us that aspirin isn't just interacting with the COX enzyme, but it also has other biochemical effects, because we know that it also prevents clotting, blood clotting, prevents clotting. It can cause the mechanisms that control the sloughing off of cells inside your stomach and intestines to change the rate in which they slough off. There's lots of different what one might call side effects associated with aspirin, other than just the fever, pain, and swelling relief. Okay, but anyway, so what we'd like to know is if this is how aspirin works, do the other analgesics work exactly the same at the same dosing to the same effect? So let's take a look back here. As it turns out, in addition to binding where the arachidonic acid would bind on the COX enzyme, that this hydrophobic part of the molecule, the aspirin molecule, has a hydrophobic part, because benzene is just a hydrocarbon, it's not polar or anything, whereas this side of the molecule is hydrophilic. Hydrophobic means hates water, hydrophilic means loves water, so you can call it nonpolar, polar, or hydrophobic, hydrophilic. Anyway, to make a long story sort of short, the hydrophobic part of the aspirin also will insert itself into cell membranes in general and reduce swelling, in addition to reducing prostaglandin synthesis, which also leads to swelling. Okay, it's kind of a long, complicated story, but the bottom line is that aspirin has more effects than just binding to the COX enzyme. It can also interject itself or embed itself into other specialized cell membranes, which also affects swelling. Okay, so this is the hydrophobic part of the molecule, which can embed into cell membranes. Well, if you look over to acetaminophen, something to tell you about acetaminophen is it doesn't have one side that's just hydrophobic. And as it turns out, there's something important about having a hydrophobic site that increases the anti-inflammatory effect of the analgesic. As it turns out, acetaminophen has very little to no anti-inflammatory effect, but it is a pain reliever and a fever reducer. So it's affecting some of the COX enzymes, but to a lesser degree than the aspirin. And the other thing about it is it doesn't have, it's not an anticoagulant. It doesn't reduce the clotting ability of blood. Okay, whereas the aspirin also reduces the clotting ability of blood, acetaminophen doesn't. So by changing this structure slightly, you've reduced some of its good effects, the anti-swelling part, but you've also reduced the fact that it can cause reduced blood clotting. This is important if you have had surgery and you don't want your blood to thin, whereas with the aspirin, sometimes that's a desirable effect. So that's why acetaminophen is given oftentimes in hospitals after people have had surgery, because it does not affect blood clotting. Okay. Now, lastly, look at ibuprofen. It looks a lot like aspirin, only it only has one functional group instead of two. And so, as it turns out, the ibuprofen is actually a better anti-inflammatory agent. And people think it's because this side of the molecule is a larger hydrophobic section, and since inserting into the cell membrane of certain specialized cells helps the anti-inflammatory function of these analgesics by having it embed more deeply and to a greater degree, than ibuprofen, as it turns out, is a better anti-inflammatory agent. It's a better fever reducer, and it's also a better pain reliever. So ibuprofen is similar to aspirin, only better. The only thing it doesn't do, again, is thin the blood to the degree that aspirin does. So there's something about this other functional group that must have some blood thinning capability that the ibuprofen does not have. So of the three, the one that's best on fever, pain, and swelling is ibuprofen. And so you may wonder, why do they still make aspirin? Well, a lot of people take it for the blood thinning characteristics, and also it's a lot cheaper. That's why. Okay, so that's a long story about analgesics and this importance of structure to function, okay, and how chemists, especially pharmaceutical chemists, have learned to engineer molecules that are drugs to give various physiological effects.